Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Hello and welcome to Puerto Rico Headline News for April 14th, 2020. This is your COVID-19 update for Puerto Rico, along with covering the numbers for today. I'm also going to cover an article that mentions how the Department of Health plans on running or having 1,000 tests to be administered on a daily basis, and we'll see how they plan on doing that. If this is your first time here, please don't forget to subscribe, like, and share this content. I did take the day off yesterday. The reporting numbers were very low, but let's go ahead and get into today. April 14th, El Nuevo Dia headline mentions that no reported deaths were reported in Puerto Rico for today because of the coronavirus. And it's the first time that it's happened in 2 weeks. The confirmed cases did go up to 923. So let's go ahead and cover this article. And it says, the Department of Health did not report deaths from the COVID-19 coronavirus on Tuesday for the first time since March 28th. So the number of deaths associated with the disease in Puerto Rico remained at 45. Now, meanwhile, the confirmed cases increased to 923, or 20 more than those that were reported yesterday. Now, the last death reported by the agency was that of a 54-year-old woman from the Mayagüez region who, after receiving treatment for the disease, died of complications due to her clinical condition or assessment. Now, according to the Department of Health press release, out of the new 20 confirmed cases, 3 were processed in the Department of Health laboratory, and 17 came from private labs throughout the island. The article continues to mention, as far as a breakdown, 52.87% of the confirmed cases are men, and 47.13% are women. The Department of Health data indicates that up to date, so far, 8,535 coronavirus tests have been conducted, of which 6,284 have come back negative, and 1,322 are still pending as far as getting results. Now, here's the only graph that was provided by the Department of Health today in this article, being the case that they now have that information, the COVID-19 information portal. It seems they're expecting everyone to go there. So I may transition and just discuss the portal. But this is the graph that's been provided. These are the confirmed cases of the coronavirus in Puerto Rico. It's divided up by age group and by gender. So here we see it still continues to be the same trend, where the highest confirmed cases are in the age group of 50 to 59, followed closely by those in the 40 to 49 age group, and very concerning, the 0 to 29 age group. In other words, those that are younger are susceptible to COVID-19 here in Puerto Rico. For some reason, contrary to other information from other countries that have been gathered so far, where in other countries it tends to hit the higher or the older groups. But here we see a very huge difference on who is catching the coronavirus or COVID-19 here in Puerto Rico. Now, the article continues. The town with the most reported cases continues to be San Juan with 121, followed by Guaynabo with 44 and Bayamón with 43. In other words, it's really highly concentrated. There's huge clusters in the metropolitan area, the San Juan area. Meanwhile, the age group, like I just discussed, the age group that continues to dominate The statistics with the most confirmed cases is that of the 50 to 59-year-old age group, and there's 205 in that group. So this is the additional article that I also wanted to cover. And basically it's from the El Nuevo Dia, and it mentions how additional purchases of the rapid tests are on hold for the time being with the scandal that the Department of Health is trying to deal with now. When they contracted construction companies and other companies with very little experience and actually no experience at all in medical equipment, they were hired to find these rapid tests, and then all that fell apart, and now they're being investigated. So any additional purchases of rapid tests, they're on hold for the time being. But before that happened, they had already placed an order. The article mentions here that the Department of Health Secretary said that out of all the tests that were ordered, they received 7,000, which came in 2 weeks ago. And then on Thursday of last week, they received 200,000 of these tests. And they began to administer them or distribute them on Monday, yesterday. Now, this is the breakdown of how they're going to distribute these on the island. It says 20,000 will be used at the airport, and 30,000 will be distributed to the elderly care centers, and the rest will be distributed among municipalities, clinical laboratories, and health centers around the island. Now, it also mentions here that González Feliciano indicated that from now on, the island will be able to carry out nearly 1,000 molecular or these rapid tests a day, between those that are carried out by the Department of Health Laboratory and those carried out by the private clinical laboratories. So in conjunction, they plan to now, actually as of yesterday, to start testing 1,000 people a day as they go through these 200,000 rapid tests that they have on hand. Now, they've also mentioned that they don't plan to use all of them. They're looking really to get, and mentions here, let me go down to the article here, because they have an actual goal of what they're trying to do. And it says here the model that they're trying to follow, it says here that the American model estimates that it is ideal that they do 6,000 tests for every 1 million inhabitants, is what the Secretary of Health said. So in Puerto Rico, about 21,000 tests would have to be done to meet that model. So they're looking to do at least 21,000 tests based on the 3.1 million plus population here in Puerto Rico. So it looks like they're not thinking about using the full amount of those tests, although it would make perfect sense to do so, and as fast as possible as well. And I'll tell you why. Just a few hours ago, the governor had to make an adjustment to her curfew or the lockdown. The mayors, the Association of Mayors, got together yesterday, and they pushed, or they insisted that the governor retract the portion of the curfew where she extended the additional 2 hours. They asked her to put it back at 7 p.m. In other words, they wanted the curfew to begin from 7 p.m. until 5 a.m. Uh, they they felt that too many people were out in the street, too many vehicles were out during the day, and being that the peak predicted or estimated here on the island doesn't happen until later on this week, going into May, it made no sense to be relaxed in the restrictions. So she announced it a few hours ago that she is heeding their advice, and the lockdown will begin from 7 p.m. until 5 a.m. Again, if the proper amount of testing was being done, as opposed to what's been going on before, where they're running maybe at maximum a little over 200 tests a day, if they had been running a lot more tests, these type of decisions wouldn't be retracted and changed based on actual numbers. So hopefully now with the 1,000 tests that they're planning on testing a day, they'll have a better idea, better information on that they can base their decisions on. So hopefully that will take place. So that's it for today. Thanks for watching. This is Puerto Rico Headline News.